We're here today to talk about neuro-optometry, which is an emerging subspecialty of optometry. It's been around since the 1980s, and there's a convention for the Society of Brain Mapping that's hosting neuro-optometry, neuro-optometric rehabilitation, and neuromodulation as sessions at the large international conference. I'm here today with Shannon Mandel, who's a nurse, speaking about dysautonomia and how eyeglasses affect it. Dr. Robert Wilson, who's here to speak on post-traumatic stress disorder and how there's changes from brain injuries. He's an emergency medicine doctor. Dr. Patrick Quaid, who's an optometrist doing neuro-optometric rehabilitation in Canada. And this is Andrea Adams-Miller, who is talking about the biopsychosocial effects of a smile and the environmental changes that go on. Everybody thinks that eyeglasses are typically meant for eyesight and the outside of you, but they're not. The eyesight is only one small part of visual processing, which is an enormous category. And Patrick Quaid has a new book coming out called Learning to See, Seeing to Learn, due out in August, and I thought he could talk about his book.
Yeah, and I think the one of the premises of that book is we started our clinic mainly looking at children with problems when they're reading. So we wanted to look beyond the 20/20 on the eye chart. And what we started to find is a lot of these children, when you looked at their movements, the eye movements when they read were significantly abnormal, and yet a lot of these kids were still seeing perfectly on the eye chart. So we wanted to look way beyond what they just see on the eye chart.
When I was working for the VA, worked with a lot of TBI patients and patients with PTSD, and then I was seeing probably one or two patients a week with TBI for an extended period of time, and I began researching, looking for possible solutions, and that's when I stumbled upon Dr. Zielinski's practice through Dr. Clark Elliott's book, The Ghost Inside My Brain. And I felt like after reading that this was a possible solution to many of the servicemen I was trying to take care of, that would lead to the impasse that they all seem to reach. These patients with TBI reach a plateau after they've gone through all sorts of rehabilitative therapy where they just don't seem to get any better. And what's interesting is there was a study done in 2014 at the U.S. Naval Center in San Diego called the Marine Resiliency Study, where they looked at patients with mild, moderate, and severe TBI. And what's interesting is they found that 100% of those patients with moderate and severe TBI went on to develop PTSD. And so if we can treat the symptoms of TBI with the neuro-optometric techniques combined with neurocognitive therapy, and thereby reduce their symptoms of TBI, it is hoped, and I'm sure that we will find that the PTSD symptoms will also improve as well. Now, PTSD, of course, is also caused by traumatic experiences that the people oftentimes experience in combat, and that would be obviously a different source of the problem. But maybe in the future we could develop techniques to treat PTSD using neuro-optometric rehabilitation therapy.
Yeah. PTSD is interesting because, as you said, sometimes they have internal causes from concussions, and other times they have external causes from witnessing something where the visual input alters the patient.
Yeah, it was very interesting. For the patients that had moderate to severe TBI, according to that Marine Resiliency Study, 100% went on to develop PTSD. And I can tell you in my practice, it seemed like almost every patient that I treated that had a significant TBI also had PTSD. But again, PTSD can be caused by multiple things, not only head injuries, but also terrible experiences can lead people to have symptoms of PTSD. And but I think that if we could make headway using the neuro-optometric rehabilitative therapy and the treatment of TBI, we will also make headway in the treatment of PTSD.
And I think that would be a great benefit to the veterans that have put their lives at danger, at risk for helping our country, and we could help them back. That would be incredible. That experience that they see from the Army and the Navy and anywhere in the military is an external visual input that creates these problems internally. And Andrea, you have background in other inputs that don't have bad repercussions.
Yeah, I do have some background in EEG and surface electromyography and biofeedback in general. And right now I'm the executive director of the Keep Smiling movement, along with the founder, Ken Rashawn. And Ken started this movement where he was noticing and witnessing people who were amplifying goodness in the world. And as part of a connection with another man named Barry Shore, had these cards where they would have people hold these cards that say, keep smiling, and pass out this positivity and love to other people.
Motion is mediated, motion and light modulation control is primarily mediated outside of the 6% that we use for the fovea for the eye chart. So it's really how well we can regulate the peripheral part of our visual system. So to understand that the eyes are the only part of the body that move, they're the only part of the brain that moves, it's really important to realize the optic nerve isn't like brain tissue, it is brain tissue.
But there's more to the peripheral retina than just the peripheral eyesight. They have studies now showing that the peripheral retina is directly connected with parts that are regulating posture centers, parts that are regulating your circadian rhythm. We even have had patients talk about hunger changes and appetite changes because your hypothalamus is in charge of satiation when you feel full, and the retina is directly attached to that. They keep finding new retinal connections, and it's hopefully the next 50 years of my life will be spent studying all that and figuring out why and how. And sounds like 50 years of your life is going to be doing research on all of that.
Now, I'm excited to hear about that too, because with the smiles, we've had some people say that when they're smiling, when they're happy, they're not hungry. When they're with other people, they feel better. We honor a lot of veterans, and with you talking about the PTSD and how they're overcoming with a social ability as well, I'm interested to know more about that even.
Sure. Well, obviously, I'm not a psychologist or a psychiatrist, but we treat PTSD in a variety of ways. We treat it with medications. We treat it with counseling, and I know that you all are now treating it with neuro-optometric rehabilitation, and I think that all of these things potentially can help. It's finding the right combination for each person, that really is what I think makes it work. So.
Now, in the book you were talking about that you're reading about the two minds and how PTSD is treated in anxiety and depression.
Yeah, and the book of Two Minds, the author basically makes a point that the brain is actually two brains, and you have the right brain and the left brain. And with patients that have PTSD, they oftentimes, one side of the brain will predominate. In some cases, it'll be the left brain, which is the logical side of the brain, will predominate. And in other cases, it'll be the right side of the brain, which is the big picture part of the brain, will dominate the feelings and emotions that the patient will have. And so what they do is they'll figure out which side seems to be causing the most reaction, the most symptoms of their PTSD, by basically having them put on glasses that block the right side of the brain, and then put on glasses that block the left side of the brain. And by doing that, they can determine, okay, in this particular patient, it's his left brain that's causing him to become emotionally upset and symptomatic. And so what they'll do is they'll make glasses which basically fade out the left side of the brain. And you do that by blocking the left lateral visual field and the right nasal visual field. And by partially blocking those and making the right side of the brain the more dominant part of the brain, it allows the individual to have their big picture take over and block out those severe memories, perhaps. And so a lot of psychiatrists are using this new technique and having great success, including Dr. Buck, who's Robert
Buck, yeah.
Yes.
One interesting thing is that neuro-optometry in general, that you all have talked about, started in the 80s with Dr. Bill Padula, but it was not as well known. And there's two people who should be thanked at getting it more well known. The first one is Clark Elliott, who's a PhD that had written the book, The Ghost in My Brain. And that's about how neuro-optometric rehabilitation got his life back after a concussion. And he combined neuro-optometric rehabilitation with neurocognitive development by Donna Marcus from her work, Designs for Strong Minds. And the second person is Babak Kateb, who is the host and the founder of the Brain Mapping Association. He is an extraordinary visionary, and he foresaw this kind of organization years ago. I've known him for over 10 years now, and he's a medical doctor who looked at what I wrote as a proposal for an optometry group, and he said the people editing it said, oh, this is nothing. And he said, no, this is a diamond in the rough. This is a profession that we need to put into our group. And because of his visionary ability, he has promoted neuro-optometry across many barriers that we would not have been able to get through, and linked up PhDs and MDs and neurosurgeons, neuroscientists, engineers from all over the world. He has done an unbelievable job with this organization.
So there's two other components of the Keep Smiling movement that we've observed and noticed. One is that people who are very confident, who seem to have abundance in their lives, seem to be the people who are most willing to be really silly and act out with their smiles. And so as we're doing, taking more pictures, I'm really interested in looking more at the research that comes along with that, with esteem, confidence, and how they feel about themselves biopsychophysically in the world with that.